Hi, my name is Ms. Keith Prevost. I'm currently a student at Liberty University. This is a video reflection assignment for my capstone course. It is my final course. I am currently pursuing a bachelor's of psychology. For this reason, I did connect with counselor Grace Bailey. She is a licensed counselor in the state of Texas. She achieved her bachelor's degree from Sam Houston University. From there, she went on to pursue her master's there as well. She explained the process to me regarding getting licensed in the state of Texas. She did let me know that she did have to do quite a bit of interning, and the majority of her interning did come from a community counseling center. So she recommended that I reach out to them. After she had achieved a certain amount of hours, she was able to go take her state exam and then go to the board for them to finalize her licensing. She stated that the process of becoming a counselor was both humbling and rewarding. She has now been working in the helping profession for about a decade now. So this lets us know that she has done significant work. The majority of her work comes from group therapy as well as individual therapy for patients with mental, behavioral, and emotional issues. She also engages in intake assessments, writing of treatment plans, documentation of present cases, and when necessary, referring patients to other professionals or other community facilities. She collaborates with schools and churches to provide psychoeducation and prevention of mental health issues. Grace elaborated that the most encouraging aspect of her profession is to witness the personal growth of her patients. She elaborated on how it feels to have patients with depression, anxiety, or trauma and started to gain back their lives through therapy and counseling. She elaborated on the importance of witnessing a part of the recovery process in person and experiencing the effects of counseling in long-term cases. As a victim of trauma, she did state that going through these cases were difficult at times, but she was able to gain something even for her own mental health throughout the process. But there were some really trying times throughout the process since she did have other things that she had experienced on her own, and she did learn how to navigate that through helping others. So she did state that watching the personal growth of others has helped her professional and personal growth. She explained that even though it is a career, it is a lifestyle that she participates even in outside of work. She has cultivated a community of leaders, and all of them do meet quite often to discuss different circumstances in the field. She does understand the drawbacks of the profession. In her words, the issue of emotional burnout dominates most of the situations. Or if there is a situation where a case drags out much longer than it is expected, and she is not allowed the resources or the opportunity to provide a patient with long-term care, that can be a bit unfortunate. Sometimes she says that she does feel guilt having to pass her patients along to other counselors that may not be as compassionate, as understanding of herself, but she understands that is the way that things work in that particular community center that she is located at. She has also commented that it is not beneficial to be discouraging when coming across. There is a shortage of professionals in certain communities, And the last thing we want to do is discourage anyone from entering into this field. She did say that mental health is something that every single person has, and mental health issues are something that about 67% of adolescents are currently struggling with. And there are a number of factors that contributed to their mental health issues. She states that she regularly attends seminars, workshops, and participates in a supervision group with fellow counselors and online courses to remain current with the most recent studies and treatment techniques. She mentioned that self-care and peer support were really instrumental in aiding her in being successful and not giving up due to burnout. She did state that she does not take a lot of time off, but when she does take time off, she does like to meditate. She does like to pray, and she does like to attend church. She said that God has been very instrumental and is the reason that she is where she is today, as well as her patience, and she is incredibly grateful. And she stated that she would not trade this field for anything else. She goes on to give advice as to how I could further my own career. She recommends getting an internship and volunteering as much as possible to avoid excessive ego, to be keen to learn, and to cultivate skills such as communication and empathy. She mentioned that the work is not only emotionally taxing, but it is also fulfilling and rewarding as well. This interview definitely gave me a clearer understanding and perspective of how life can be in the helping profession. I did have a few ideas of the area of mental health that I did want to go in, but seeing Grace work with children kind of has me wanting to place myself in that direction. She mentioned that although there are mostly situations where she finds herself counseling, there are also times when she finds herself being more of a teacher and more of a support system for her patients. This interview has reinforced my interest in the mental health field. I am incredibly grateful that I got the opportunity to interview Grace. I look forward to maybe possibly working alongside her one day. But she has really reinforced my perspective, and I'm incredibly grateful. My name is Ms. PRrevost, and this is my video reflection assignment. Thank you, and take care.